Good afternoon, everybody. This is Dr. David Tam, President and CEO of Beebe Healthcare. First, apologize for the slight delay in starting our coordinated Blue Jeans as well as Facebook Live public town hall for today. Today's town hall is on February 25th, 2021. It is now a little bit after 5 p.m. and I am transmitting from the Margaret H. Rollins campus here in beautiful downtown Lewis on a beautiful sunny day here in Delaware. It makes me glad to be here as we talk to you today and share with you the latest up-to-date information about COVID-19, the vaccination process, and healthcare as it stands today here in Sussex County, Delaware. You know, Beebe Healthcare is your local, nonprofit, independent community health system, and it is so important for us to always communicate with you about what is going on. I know that for all of you, the COVID-19 situation is still an important issue. It is the preeminent healthcare issue for all of us here in the United States as well as around the world, and that the vaccination issue is so important for so many people. We are now at a place where we will have Dr. Bill Chasinoff, who will once again join us to talk to you about where we stand with COVID-19, where we stand with our vaccination process, and make sure that you get the most up-to-date information about how you can be on the lists so that you don't get left behind. That is so important to us here at Beebe Healthcare. Now, I also will talk a little bit after that about what's going on here at Beebe Healthcare, because we are looking forward now to dealing with other issues besides COVID-19, knock on wood, as we start to enter the busy part of the year. And it is going to be my privilege to share with you about some of the exciting things that we're doing here at Beebe Healthcare. You know, Deepak Chopra said that all great changes are preceded by chaos. And we can all agree, I think, that the last year was totally chaotic. But it gave us here at Beebe Healthcare the opportunity to really reshape what we do and make sure that we provide the services necessary so that as we come out of this pandemic crisis, that we will be able to provide the necessary services so that you don't have to travel, that you don't have to go away, and that you can continue to get the same high quality, technically advanced, and community and family friendly services that you got from us with the COVID vaccine, with the COVID pandemic, and now you'll be able to get with so many other things. As you know, we opened up our cancer center and our South Coastal Emergency Room. We stay on track with the opening of our specialty surgical hospital on Route 24, and we're doing a couple other things. I'm happy to announce that we have brought Dr. Diana Dixon Whitmer, a preeminent world-class breast cancer surgeon, down here to Beebe Healthcare, who will really kickstart our breast cancer and breast health program. And she starts seeing patients actually March 8th. This is going to be so important as we identified that there are so many people, so many women who have to leave our area to get breast cancer care and breast health care that they don't really have to move away from this area for, that we can provide those services now, especially with our second cancer center. And we're so excited to have Dr. Diana Dixon Whitmer, truly a nationally recognized breast surgeon here so that we can provide those kinds of services and grow those kinds of services. I'm also happy to announce that Dr. Tarek Wakid, a amazing bariatric and general surgeon, will also be joining us. He is somebody who is well known throughout the county and will be bringing to us the creation of the Beebe Center for Weight Loss Surgery, a comprehensive metabolic and surgical weight loss program right here in our part of Sussex County to make sure that, once again, patients get the very best innovative, advanced, safe, quality care at Beebe Healthcare. You know, the other thing we have always identified as a challenge is to make sure that we have neurosurgical services right here in our part of Delaware, in our part of Sussex County. And I'm also pleased to announce that Dr. Jim Mills has joined our medical practice and that we are providing him all the technical equipment and expertise and support to ensure that we provide a neurosurgical program here at Beebe Healthcare so that people who have head injuries or strokes or other kinds of things don't necessarily have to be automatically transferred out of our area. And that's so important as we start bringing visitors back in and family members are staying here with their patients and their families rather than going someplace else. In the last 7 months alone, we have worked very hard to expand our primary care and specialty services in an effort to ensure that we provide comprehensive, advanced, high-quality care to the people of Sussex County. We've brought on three endocrinologists because diabetes and other hormonal problems are so important for the health care of our population. We've brought on 2 more OBGYNs, and in addition to the ones that we, of course, hired in the past summer, and we have more coming on the way. We have 5 new family practice providers and other primary care providers, all accepting new patients throughout all our clinics here in Sussex County, and they will be coming up on board. And we also have one single phone number that is 302-645-3222 so that patients can call to get a Beebe family provider. And I think that's so important as we continue to expand our primary care services to make sure that we provide care for you without having to go someplace else. We have a new neurologist who signed on and with more on the way to support our programs. We have a new female urologist, Dr. Elizabeth Mulroy, a new gastroenterologist to support and improve upon all the GI services that we already have here, a new dermatology provider, and many, many more. I want you to know that these are all part of our heavy focus on ensuring that once we get through this COVID-19 pandemic, as people now feel comfortable getting back to the point where they are taking care of themselves, where they're getting their mammograms, where they're getting their primary care screenings, and then they need specialty referrals to take care of all the problems that were identified, that we will have cardiac, neurosurgical, neurosciences, oncology, OBGYN, gastroenterology, pulmonary, and all those services that will ensure that the people of Sussex County who relied on us, you who relied on us for COVID-19 care, can now rely on us for continued primary and specialty care here in Southern Delaware. Very exciting, and we're all here for you. But I'm going to switch gears a little bit because I know I'm excited about the future. I know that as a CEO, I'm always thinking about the future, but we know how important it is for you to have the latest information about COVID-19 and the vaccine. And so I'm going to turn it over to Dr. Bill Chasinoff, our medical director for COVID-19. Once again, a really, really intelligent, well-versed, educated, infectious disease specialist who's actually from this area, went away to go to school, but decided to come back and serve the people of Sussex County. And we're so fortunate to have him. And thank you, Dr. Chasinoff, for the work that you're doing. And I'm going to turn it over to you now. Bill, take it away.
Thank you, Dr. Tam. That's a very kind introduction, and I just want to state that for those of us who grew up in this area, such as I did, how amazing it is that we are bringing all those services in to really, my family, my friends, and all our neighbors. It's something that's been needed for some time, and I'm extremely excited to be a part of that, and I know that you're extremely excited and have every reason to be, so thank you. So for those of you who do not know who I am, my name is Bill Chasinoff. As Dr. Tam had alluded to, I am an infectious disease specialist here in Lewis, Delaware. I was born in Milford, Delaware, and grew up in the area and have lived in Delaware for most of my life. I moved back to this area about 3.5 years ago after I saw the opportunity of where Beebe was going and knowing that I would like to be a part of making a difference for my family, friends, and neighbors. So I've been here for just over 3.5 years. I also act as the COVID-19 medical director for Beebe Healthcare, which obviously has been quite challenging over the past 12 to 13 months. But because of that, I have had the opportunity to bring hopefully some important information to all of us that have hopefully saved many people from getting ill and ending up in the hospital. So I just want to thank you for the few minutes that you provide me tonight so I can give you some updates on COVID, talk to you about the vaccine, and perhaps some other hot topics about COVID in the news. I normally start by talking about where we are in COVID. And what I'm going to do is actually provide some numbers. These numbers are all available through the State of Delaware coronavirus website and the Johns Hopkins coronavirus map. So what I'm going to provide are the numbers as accurate as of this morning. So since the start of the pandemic, worldwide, we have had greater than 112 million confirmed cases of COVID-19. In the world, since the start of the pandemic, we have had approximately 2.5 million deaths associated to COVID-19. In the United States, we have had confirmed cases of greater than 28 million, with greater than 505,000 deaths contributed to COVID-19 since the start of this pandemic. In the state of Delaware, we have had greater than 85,500 confirmed cases, and we have lost, unfortunately, greater than 1,400 Delaware residents' lives due to COVID issues. The good news is that we have been seeing a drop in the new number of confirmed cases on a daily basis, not only in the United States, but also in the state of Delaware. We have also seen a decrease in the number of hospitalizations throughout the state of Delaware, and that appears to be decreasing on a weekly basis. The hospitalizations in Delaware had another peak that occurred around the middle of January, where there was over 470 patients hospitalized throughout Delaware for COVID-19 or COVID-19 related issues. As of this morning, we were just over 180 hospitalized patients throughout the state of Delaware. So you see that the numbers have continued to decrease, but I think that it's also important to realize that they have not gone away. So we still have over 180 of our neighbors, families, friends, and loved ones hospitalized because of COVID-19 throughout the state. I say this because as the vaccine continues to provide us hope of getting back to normalcy, it's still just as important if you have been lucky enough to receive the vaccine or you have not received the vaccine to remember the 3 W's, which is washing your hands, wearing a mask, and watching your distance. Those 3 things will continue to be important with or without the vaccine for the next several months. Back in the spring and summer of 2020, the majority of questions that came my way, that came Dr. Tam's way, that came to really all of us, all of the team members at Beebe Healthcare is, how do I get tested for COVID-19? When can I get tested and when should I get tested for COVID-19? And then when will my results for my COVID-19 test return? Those questions I'm actually asked a lot less nowadays because Beebe Healthcare had set up testing sites along with many other organizations to make sure that those in our area and in the county and throughout the state and ultimately the country had opportunities for getting COVID-19 testing. What is now happening is, and rightfully so, is that the questions that I'm being asked are really about the COVID vaccine. Where can I get the COVID vaccine? How can I get the COVID vaccine? When will I be able to receive my second dose of COVID vaccine? So the questions have changed as the climate has changed around COVID. So I do want to take a few minutes to just talk to us about the COVID-19 vaccines. Currently, the United States Food and Drug Administration, which we know as the FDA, has provided authorization for 2 vaccines in the United States. One of those is the Moderna vaccine, and the other one is the Pfizer vaccine. Both of these vaccines require 2 vaccines separated by either 21 or 28 days in order to complete the vaccine series. So for instance, if I get Pfizer today, 21 days from now, I should be receiving my second dose of Pfizer COVID vaccine. If I have Moderna today, I should be receiving my second dose of Moderna vaccine in about 28 days. Now, it's also important to realize that there is a little bit of leeway between that 21 days for Pfizer and the 28 days for Moderna. It does not have to exactly be 21 or 28 days. You can receive both of those a few days earlier than the 21 or 28, and the CDC has a recommendation that you can receive those vaccines for up to 42 days after your first dose, and that's for Pfizer or for the Moderna vaccine. They have even stated in their guidelines that if someone is unable to receive their second dose by that 42nd day, they should receive the second dose when they're able to, and you do not have to restart that series over again. Now, I do want to put a caveat, a warning into this, that these guidelines and these recommendations are recommendations, that if this information changes, that we will try to update you on that information change. As we all know, over the past year, some of the things that we learn about today are different even in a day or two from now. Things are constantly changing. I do want to talk about that it's important to realize what these vaccines do. So the Moderna and the Pfizer vaccines are effective in decreasing serious COVID infection and ultimately hospitalizations and death. It is important to note that these vaccines do not provide anyone 100% guarantee that they will not get COVID if exposed to the virus. And I think that's extremely important to remember, to the point that I'm going to repeat that again. These vaccines are effective in decreasing serious COVID infection and to decrease hospitalization, but they are not 100% guarantee that someone will not end up with COVID if they are exposed. I do not say that to frighten anyone. I say that to understand what these vaccines are created for and what we know that they can do as of this moment. I have always told you that I will give you as much up-to-date information that I'm aware of. So I'm going to talk to you about an important study that came out in a very prestigious medical journal yesterday being February 24th, 2021. The New England Journal of Medicine had an article in there that was looking at the Pfizer vaccine. The study took place in the country of Israel. It had approximately 1.2 million participants in this trial. This is not a clinical trial. This is not that prior trial that Pfizer used to present to the Food and Drug Administration to show its effectiveness. This trial was more of what I call a real-world trial. So in this 1.2 million participants, 600,000 of them were watched after they had received the vaccine, and the other half, which was about 600,000, had not received the vaccine yet. And they followed these people, and they followed the ones who were vaccinated after their first dose and after their second dose. What they found is that after receiving 2 doses of the Pfizer vaccine, that someone had a 92% less chance of severe COVID disease than those who had not received the vaccine, and that there was 87% less chance of needing hospitalization after receiving the second dose of Pfizer than if you had not received the vaccine at all. Why I point that out and why I give you those numbers is not to make your head spin. It's to realize that I did not mention there 100%. There is no 100% guarantee that someone would not get very ill from the COVID infection. there was not a 100% guarantee that someone would not need hospitalization after becoming infected with COVID, despite receiving those 2 doses of vaccine. I say that again, not to scare you, but to understand what the limitations of that vaccine are. And it's extremely important, again, to remember that's why everyone continues to tout the 3 W's. Wash your hands, wear a mask, and watch your distance, even if you have been fortunate enough to receive both doses of the Pfizer or the Moderna vaccine. With that being said, I do want to talk more regionally. I want to talk about the COVID vaccine in the state of Delaware. So the state of Delaware is moving through something called a vaccine allocation phased process. And that's a really fancy term for just saying, how are the vaccines, the COVID vaccines, being offered to Delawareans? So if you remember, back about 2 months ago at this point, we started to receive COVID vaccine in the state of Delaware. We had opened up, and I say we as in the state of Delaware, not we as in myself or Beebe, but the state of Delaware, opened up vaccine possibilities for healthcare workers and for long-term care residents, and said that they were under phase 1A. A is in apple. In addition to that, there was also emergency medical service personnel that were included in that 1A group. So as phase 1A started to be vaccinated and vaccine was offered to phase 1A, the state of Delaware had moved forward with their second phase, which is known as phase 1B, B as in boy. Phase 1B is a significantly larger group than phase 1A was. Phase 1B included those who are 65 years of age or older, and it did not matter if they had medical conditions or high-risk medical conditions or not. That was completely age-based. It also included additional frontline essential workers. It included fire, police, correctional officers, education staff, such as teachers, U.S. postal workers, and several others in that group. What the state of Delaware has done with phase 1B is to actually move forward with the first large group being those that are 65 years of age or older to be offered vaccine first. They are now attempting to move forward with those other groups that I had just previously discussed. So we are still, and again I say we as in the entire state of Delaware, all of us are moving forward as available and vaccine is available with those other groups. But not all those groups have been offered vaccine yet, and hopefully that will occur in the very near future. I think it's important to bring numbers up again here, not to make anyone's head spin, but just to understand where we are in the state. So in the state of Delaware, we have about 1 million people that live here. We're just shy of 1 million people in the most recent census data. And when the state of Delaware moved towards phase 1B and opened that opened up greater than 200,000 Delawareans now becoming eligible for the COVID vaccine. If you remember a couple minutes ago, I did mention that the Moderna and the Pfizer vaccine both required 2 doses in order to complete that series. So if we opened up 200,000 Delawareans being eligible for the vaccine and we times that by 2 doses, that's a need of 400,000 doses of vaccine. We obviously have not seen 400,000 doses of vaccine in the state of Delaware. And it's also important to realize that here in Sussex County, according to the most recent census data, we are estimated to have about 240,000 people that live in our county. Out of those 240,000 people, approximately 30% of those are 65 years of age or older. So just doing some simple math, that's approximately 70,000 people in our county alone that have become eligible for vaccine just because of their age. So that does not include 1A, which are the healthcare workers, and it does not include those who are also in that other portion of 1B, the other frontline essential workers and others. So as you can see, that state of Delaware is working as hard as they can to allocate vaccine from the federal government, which eventually will hopefully come to us in a continued fashion at Beebe Healthcare, in order to give as much vaccine as possible to Sussex County, our neighbors, and our community. I do have some good news about this, though, and this information is all, it's important to note, is all found on the State of Delaware coronavirus website. Nothing that I'm giving you here is by far secret information. It's all information that can be found. The entire state of Delaware, with the most recent update at the coronavirus vaccine tracker, has been able to administer approximately 196,000 doses of vaccine. When I looked at how Delaware was ranking last week out of all 50 states, we were number 8 in receiving vaccine and getting it into the arms of those who were eligible for the vaccine. So we are in the top 10 states, or at least we were last week, of being able to do that. So I say that because there are times when we're all frustrated because we were not able to get the vaccine as fast as we thought we could, or the supplies have not been there in order to get vaccine to all the people we want to get vaccine to. Please be patient. We are doing a good job in Delaware, and Beebe Healthcare is happy to be a part of the partnership with the state of Delaware to try to get as much vaccine into eligible community members as possible. Really, I give you those numbers not to make anybody confused. It's just to show that we have obviously a larger demand for COVID-19 vaccine at this moment than we have current supply. So what are we doing here at Beebe Healthcare to try to help our community, knowing that we have this very limited supply of vaccine? Well, at Beebe Healthcare, we continue to work around the clock to obtain as much vaccine as possible for all of us, for our family, our friends, our neighbors, our patients, everyone that we can get vaccine who is eligible for vaccine. We are doing our best. We have established a waiting list for our community members to sign up for if they would like to join the Beebe Healthcare COVID-19 vaccine waiting list. This, and I'm going to say this slow just so that anybody who may be wanting to write things down, although I believe this is recorded, so just go back 30 seconds. If you go to beebehealthcare.org, you will see a yellow tab towards the top, and it says COVID-19 Resource Center. If you click on that yellow tab, it will take you to a page where there will be another yellow highlight called Vaccine Information. I want you to click on Vaccine Information there. That will take you to a place that says Waiting List, and actually it is called the Vaccine Waiting List. Please click on that, and there is a very simple form to be completed, primarily asking information that we need to know where you fall when the vaccine is eligible to you, but also how to get in contact with you, which is most important. If anyone feels that they have difficulty, navigating the website, we know how important it is because we all have neighbors that may not be technology savvy, and we all know that sometimes these websites can be a little bit difficult. Monday through Friday, from 8 a.m. to 4:30 p.m., you can call 302-645-3200, which is the COVID vaccine number, and there will be someone there who can help get you manually registered onto the waiting list. They will ask those questions for you and get you put in just as if you had completed that form on the website, and that's extremely important to know. If you have neighbors or family or friends that want to get on the waiting list but feel that they are having trouble, please share that number. We do have thousands of people on our waiting list, And as supplies are available, we are moving through that waiting list as fast as we can in order to get vaccine into as many people who want it. With that being said, I do want to take a moment to let you know that we here at Beebe Healthcare know how to give vaccines. We have been doing flu vaccine clinics for years. We do those not just for our team members here at Beebe Healthcare, but we also do those for our community members, and we have flu clinics. This year, if any of you were around, we did flu clinics throughout the county as drive-through events, and they were very successful. We were able to vaccinate greater than 5,500 community members just at these community events. We know how to give vaccines, and we know how to give vaccines well. With that, we have been reached out by partners and local organizations in the state of Delaware to help in order to provide vaccines to our community members in different venues. And we have been happy to do that. We've been happy to partner at times with local churches, also with the state of Delaware and other organizations with the permission of the state of Delaware in order to be the vaccinators at these community events. This is something that we think is extremely important to get to some of the populations that have difficulty accessing medical care. It's really important that we are all one community and that we are all in this together. So I can tell you that I and Beebe Healthcare, and I know that Dr. Tam, are all extremely proud of being able to partner with these organizations in order to do what's right. And thank you all, keeping an eye on your neighbors and your community members to make sure that this is happening as well. I do want to spend a moment to talk about a couple hot topics in the news. One of those is that there is a third vaccine coming from Johnson & Johnson. This will actually start the review process tomorrow, which is Friday, February 26th. It will go through the same rigorous review as the Pfizer vaccine did, followed by the Moderna vaccine. So there will be more information, and you will hear most likely in the news that this vaccine is starting to be reviewed as early as tomorrow. Again, this we expect to be authorized within the next several days to the next week or two, but it will go through, and it being the Johnson & Johnson vaccine, will go through the same rigorous review as the prior COVID-19 vaccines that are available. For the next couple minutes, I also want to talk about something that you may be hearing about in the news, and this is about the different COVID-19 virus strains that they're talking about quite a bit. It's important to know that viruses change over time. So all viruses do that. The flu virus does this very fast, and that's why we need to receive a different flu vaccine every year. And again, this change is normal, and we as physicians, doctors, clinicians, scientists call this change a mutation. So most of the time, this change or this mutation leads to a virus that's actually less hardy and normally is not as good as the virus that it had come from before the mutation or the change had occurred. Occasionally, some of these changes or mutations lead to a hardier virus that actually can become, in certain cases, more infectious than the virus that it had changed from. So there are three strains of viruses that have mutated or changed that are being talked about very frequently in the news, and I just want you to be aware of them. One is called the B as in boy 117 strain, also known as the United Kingdom strain. The second one is B as in boy 1351 and is known as the South African strain. The third one is P as in Paul 1, and that is known as the Brazilian strain. These three strains have all been identified in the mainland of the continental United States. So they are all here. These strains are here and have been here likely for several weeks at least. It is believed that the United Kingdom strain will be the predominant COVID-19 viral strain by probably mid-April. And that's looking at different models that mathematicians use to kind of identify how fast something spreads. What I'm going to talk to you about for the next minute is just what we do know and what we may not know about these strains. All three of these strains appear to be more infectious than the strains that they came from, meaning that they have, if someone is infected with one of these strains, there is a greater chance, if they are not following the 3 Ws, to infect more people than if they had had the strains of the coronavirus or COVID-19 virus that we had known about several months ago. The good news is that these changed viral strains, or these changed viruses that I just mentioned, do not appear to lead to more people going to the hospital or more people passing away, which is some good news. But we do know that the more people who become infected, which is what these strains do, does increase the chance that someone may end up in the hospital. So it is important, again, to make sure that we're all following the 3 Ws now that these strains have been identified. It appears at this moment that the Moderna and the Pfizer vaccine all have activity against these newer strains of the COVID-19 virus. Now, that is being looked at, and there is work being done to ensure that that statement is true, but the initial information appears to be that the vaccines are effective against those strains of the virus that I just discussed. So I wanted to share that with you because I feel that that is something that, at least when I turn the news on, it seems to be talked about quite frequently. So with that, I hopefully have not bored you all to a nap, but I do want to thank you for your time this evening. It's always a pleasure doing this and talking to you and making sure that you have the most up-to-date information that I have. I want to thank you all for your ongoing support for Beebe Healthcare, and especially to our team members who are working so hard to keep our community, our neighbors, our family, and our friends safe. And remember, if you've been vaccinated with the COVID-19 vaccine or not, it's just as important to continue to look out for one another, and you can do that by washing your hands, wearing a mask, and watching your distance. I hope you all have a wonderful evening, and I'm going to turn this back over to our CEO and President, Dr. David Tam. Thank you.
Thank you, Bill. I'll only take a few more minutes and then we'll let you get on with the work of life. Listening to Bill, Dr. Chasinoff, and talk about all the things that we have gone through, it reminded me a little bit about an experience I had back when I was in San Diego and in the Navy, where I had the opportunity to be an observer at Hell Week. As you know, that's the training that the SEALs go through, and there is one time where they are going through Hell Week. They don't sleep, they don't eat, they're constantly being tested and yelled at, and they're physically exhausted. And yet at the end of it, the SEALs come out stronger. They come out more confident and able to get on to the next phase of their training as they serve their country. Now, this pandemic in the last year has also been sort of a hell week for those of us here at Beebe Healthcare. But I will tell you this, in some ways, this pandemic has forged the steel of Beebe Healthcare through the crucible of the pandemic. And we have come through it stronger. We have come through it more focused. We have come through it more centered on the community and more agile and able to provide more services for everybody here in Sussex County. I've been here now for almost a year. I started March 17th. And I can tell you that I myself have in some ways been through that crucible as, it's been a very difficult year of change for me as we had the pandemic and still running the organization, making decisions, learning people, meeting with new people. But I've been to Georgetown, I've been to Epworth, I've met people at La Esperanza, at Mount Air, and Millsboro, here in Rehoboth, Lewis. I've become a member of the American Legion post here. It has been a difficult but gratifying experience, and I think that I hope that I, as well as all of us here at Beebe Healthcare, have, as a result of all that we have done to protect you and take care of you during this pandemic, earned your trust to be your healthcare leader, to be your go-to source for all your healthcare needs here in Sussex County. We're not going to stop. We're not going to take a break. We're going to keep going. We're going to keep growing and advancing our ability to provide advanced, innovative healthcare close to home, just like we have done this entire year with COVID-19 and the pandemic. We're going to be the people you can trust with your healthcare needs for you and your family. So thank you very much for being here with us. Thank you very much for hopefully staying with us and being our partner, allowing us to be your partner in healthcare as we all get to the point now where we're focusing on our health, on dealing with our medical problems, our strokes, our heart attacks, our surgical issues, our breast cancers, our colon cancers. We are going to be here for you. Thank you so much for your support. Thank you for all your donations. Thank you for supporting our medical foundation. And we're going to get through this together, and we're going to come out of it stronger and a better community here in Sussex County. Thank you very much. Have a great night.